Post-concussion syndrome is a serious medical issue that has far-reaching effects for both patients and their families. Post-concussion syndrome is either a direct or indirect result of a concussion producing a range of symptoms that last longer than 3 months, such as headaches, cognitive complaints, and attention deficits. Another term often used is mild traumatic brain injury. However, experiencing post-concussion syndrome is anything but a mild experience. Head injuries are some of the most common injuries in the Western world. Between 70 and 90% of head injuries are concussions. Post-concussion syndrome is a significant cause of morbidity in up to 90% of patients with concussions. Over 4 years, the rate of concussion has increased by 30%. In the past, it was believed that children were less susceptible to concussions. However, new research shows that this is not the case. Youth 18 years of age and under are in fact more susceptible to concussions and brain injuries. Their increased susceptibility may be due to factors such as immature musculature to support the head's weight, underdeveloped myelin sheaths, and thinner cranial bones to resist physical impact. Receiving a concussion causes direct damage to the brain. Structural damage of the brain directly affects the white matter that makes up many regions of the brain. White matter is a whitish appearing tissue that consists of nerves which make up the brain and spinal cord. A new CT and MRI scanning technique found a strong correlation between the severity of post-concussion syndrome symptoms with the reduction of white matter integrity. Functional imaging studies explain fatigue as a result of recruiting brain tissue not normally required for a given task, as well as increased energy use to accomplish a task. People with concussions experience a variety of symptoms, but what is the difference between the symptoms of a concussion versus symptoms of post-concussion syndrome? Essentially, symptoms of post-concussion syndrome are exactly the same as any concussion, except symptoms of post-concussion syndrome persist past the expected time frame of a concussion, which is 10 days. The main symptoms are neurosensory. Some symptoms people with concussions most likely experience are headaches, dizziness, fatigue, ringing of the ears or difficulty hearing, difficulty sleeping, and difficulty concentrating. They may also experience emotional changes, such as feelings of apathy, a low mood, and irritability. There have also been a number of recent studies that have shown that receiving a concussion may put individuals at an increased risk for developing depression and anxiety symptoms. Prevention is key to the treatment of post-concussion syndrome. Prevention of post-concussion syndrome can be made possible through an initial assessment. The initial assessment for post-concussion syndrome involves an interview which serves to gather important information and to build rapport with the client. Along with the interview, an assessment of primary symptoms should be conducted, and the client's balance and vision should also be assessed, because nearly half of clients show signs of dizziness within the first few days of the initial concussion. It is suggested that a correction of headaches, sleep, and mood disturbances should take priority as they impact cognitive functioning, and clients typically respond well to focused therapies. After this, treatment for patients is individualized based on symptoms. There are a number of myths associated with concussions. A few of the prominent ones are: an MRI CT scan or computer paper tests are able to see all concussion symptoms. However, many scanning and evaluative tests are not able to detect all mild brain injury symptoms, and this can lead to false conclusions. Another myth is that you need to be hit on the head or knocked out to have a concussion. However, concussions can be caused by whiplash to the neck, and only 10% of concussion victims are knocked out. And finally, another myth is that concussion symptoms are not similar to being under the influence of alcohol. However, many concussion symptoms mirror symptoms of alcohol intoxication, such as slurred speech, memory problems, and hand-eye coordination. Feeling stuck? Feeling alone or helpless? Help is available. As mentioned earlier, post-concussion syndrome puts individuals at an increased risk for developing depression. This could make recovery difficult, as symptoms of depression may be accompanied by apathy and suicidal thoughts. A lack of treatment of depression for some patients who have concussions has led to suicide. If you are experiencing any of these symptoms, be open about what you are experiencing and share what you are feeling with your trusted friends, family members, and family doctor. It is also important, even without a concussion, to take care of yourself. This involves having a well-balanced and nutritious diet. Recovery from post-concussion syndrome takes time, so it is important to be patient with yourself and gradually return to activities you normally did before your concussion. For more information on accessing support for depression and establishing a well-balanced and nutritious diet, you can refer to these links for assistance.